Remember that scene in Pulp Fiction where Uma Thurman's character Mia nearly dies from a heroin overdose? She is on the floor, unresponsive, nearly dead, until she gets a shot in her chest, screams, and startles back to life because of a shot of adrenaline. That's right. Adrenaline is powerful enough to bring you back to life. It can also disable you. Adrenaline injections have been commonly used during CPR for cardiac arrest for more than 60 years. Adrenaline can increase the likelihood that the heart will regain a normal rhythm as it directs blood flow to the heart. However, it also causes constriction of small blood vessels, which can reduce blood flow to other organs, including the brain, and may lead to neurological damage. In people with connective tissue disorders like Ehlers-Danlos disease, the valves are not closing sufficiently and blood is then pooling in the legs. This also likely occurs in people with low blood pressure, especially when they aren't sufficiently hydrated. The response is the body has to increase adrenaline in order to return the blood to your heart and brain. This predisposes you to dysautonomia and postural orthostatic tachycardia syndrome, POTS. When too little blood circulates back to the heart, a reflex interaction happens between the heart and the brain. The blood pressure can either drop, resulting in feeling faint, or the heart rate can speed up due to adrenaline release, resulting in heart palpitations and a feeling of anxiety. These reactions distress the body, especially the heart and autonomic nervous system, and can cause negative chain reactions which affect your overall health and well-being. Insufficient venous return causes the legs to feel heavy. Short-term, it can cause leg pain, swelling, cramps, skin changes. Long-term, it can cause autonomic nervous system dysfunction, heart and kidney issues, peripheral nerve damage, and cognitive symptoms due to decreased blood flow. It is extremely important to follow these next tips to avoid causing additional body distress if you have low blood pressure, symptoms of dysautonomia, or POTS. Try to be consistent with all of the tips for at least 30 days or as long as you have symptoms to help your body to recover. Blood is the essence of life, and blood flow is vital to our survival. Maximizing venous return can help take stress off of our body by reducing adrenaline in our system. Venous return is the transport of blood from the capillaries to the vein and back to the heart. It's supported by muscles pumping, venous valves, respiratory pressure, smooth muscle, and gravity. Something that can help with venous return is wearing compression. Compression stockings and compression leggings decrease blood and pooling in your legs. Compression leggings tend to be the most effective and must reach all the way to your ankle when worn. Compression over your waist can assist as well, either via high-waisted compression leggings or an abdominal binder. Some medical-grade compression can be hot or uncomfortable. Any compression is better than no compression. Athletic wear like Under Armour also offers non-medical grade compression. If you have symptoms in your arm, such as fatigue with overhead lifting or swelling, compression sleeves or compression gloves may also be helpful. Blood pooling worsens dehydration and dysautonomia. When blood pools in the lower half of your body, your kidneys see too much blood volume. The kidneys then work overtime to get rid of fluid and electrolytes that the body desperately needs. This is called the aldosterone paradox, and it can cause low-grade kidney and cardiac distress. It's estimated that there is between a 10 to 15% reduction in body fluid volume in patients with dysautonomia symptoms. Patients have to consistently overhydrate and add additional electrolytes, especially salt, to break this cycle. People tend to dehydrate at night. Sleeping on a wedge or elevating the head of the bed can help with this. First thing in the morning, drink 30 to 50 ounces of warm water. Add 1/4 to 1/2 teaspoon of salt if you have low blood pressure. This will help to rehydrate your body from fluid loss overnight. Gradually increase your water to 100 ounces per day or more. Make sure you are getting sufficient salt through supplementation if your blood pressure typically runs low. Before doing any activity where you need to stand or before you leave the house, drink another 10 to 20 ounces of water to help your system tolerate the upright position. Large pushes of water tend to help your system more than sipping. If feeling faint, blood pressure drops, or heart rate spikes continue to be an issue for you while standing, consider talking to a POTS or long COVID doctor to see if IV fluid therapy is an option. The amount at which IV fluids can become too much vary from person to person, but a typical starting idea may be 1 to 2 times a week for 30 to 60 days to help stabilize your system. Mobile IV therapy is often available as an out-of-pocket expense in larger cities as a health and wellness option. IV fluids should not be used as a substitute for these lifestyle modifications. If you start craving fast food, have low blood pressure, or your urine looks lighter than lemonade color, that's an indication that you need to increase your salt intake. 10 grams, about 2 teaspoons of salt a day, is recommended for people with hypermobile Ehlers-Danlos syndrome, dysautonomia, or POTS who do not have high blood pressure. Salt earlier in the day is better. Bone broths and soups are a nourishing mix of salt and liquid. Avoid electrolyte mixes with sugars, sweeteners, or sugar alcohols. Avoid carbonated beverages, alcohol, and energy drinks. About 30% of people have worsening symptoms from coffee or caffeine use. If you do drink caffeine, talk to your doctor about taking an L-theanine supplement for nervous system support. Tip number 4, make your leg muscles work. Blood pooling occurs the most often when you are standing, especially when the knees are locked. Avoid knee locking and standing still at all costs. Instead, channel your favorite martial artist or a sports icon and assume a ready position. A wider stance and gentle rocking or weight shifting back and forth engages your leg muscles, which promotes venous return. Make your leg muscles work, especially your calves. Your calf muscles are the drivers of oxygen distribution in your body. Walk consistently, even if it's just for a couple of minutes every hour. Calves work harder when you are walking with a typical gait. Use a heel-toe gait as opposed to walking on just the balls of your feet. Use zero lift, a flat shoe where the toe and heel are on the same plane, as opposed to a lifted heel or high heel, which takes away from that natural pattern. Consider performing a few calf raises during the day to help with your circulation. Do not over-exercise if you have post-exertional malaise or exercise intolerance. Make sure you are breathing slowly through your nose with all activity, limit walking to a few minutes at a time, and take a rest break after if post-exertional malaise is a problem for you. If you frequently work at a desk, get up every hour. Consider using an under-the-desk cycler or elliptical intermittently. Tap your toes to music. You can also take an exercise band and tie it between your desk legs and push against it with your feet. Sitting on an exercise ball for part of the day improves your posture and also engages your leg muscles. The next tip is to make gravity work for you. Use positions where your legs are up throughout the day to help your venous return and circulation. You can even perform wall workouts where you work to increase leg muscle strength in the legs up position, which may decrease the effects of exercise intolerance. You don't necessarily have to get on the floor to perform this. You can do it in bed or on a couch as well. If this causes a headache, put a wedge or pillow or two between your shoulder blades and the head to elevate them. Avoid typical seating positions where your legs are down. Having your knees elevated above your hips helps to avoid blood pooling. The following page has some examples of positions that you can try out. Using a recliner to bring your legs up, a deep squat, cross-legged sit. You can sit on a folded blanket or cushion and alternate sides for hip health. Use a stool or footrest to bring your feet up while sitting. Laying on your stomach or a sideline are also great options. A squat position is better than bending over. It is also a great safety position to get into if you start feeling lightheaded because it lowers your center of gravity. Make sure you have the leg strength and hip mobility to get to a squat if and when needed. This is an example of how you can train your body to get more comfortable getting into that low squat. Tip number 6 is avoid the heat. Heat is a vasodilator, which means it makes it easier for blood pooling to occur. Avoid getting too hot during movement or when outside. You must stay adequately hydrated and have sufficient salt. Wear breathable compression when it's hot, and especially avoid standing still in warm places. This is why so many people are triggered by standing still in a warm shower. I highly recommend taking cooler showers with a shower stool or finishing your shower or bath with cool water to avoid triggering an adrenaline release or your sympathetic nervous system. Talk to your doctor or specialist to make your supplements and pharmaceuticals work for you. If your blood pressure is low or you have Ehlers-Danlos hypermobility, POTS, or symptoms of dysautonomia, avoid taking medications that may lower blood pressure or cause drowsiness. If you take meds for high blood pressure, work with your doctor or cardiologist to make sure your dosage is working for you. Some supplements that are commonly used for cardiovascular health are as follows: vitamin D3 plus K2, CoQ10, krill oil, fish oil, or omega-3, and theanine or green tea like matcha, and magnesium. Good breathing is just so important. Good breathing, mindfulness, and meditation all activate your rest and digest state. This can help you to avoid being in fight or flight mode, which is also associated with adrenaline. Additionally, breathing is the primary way to pressurize your system. Your lungs act as a pump to drive blood to the heart and cerebrospinal fluid to the brain. Pressurize your system with diaphragm breathing. When people breathe in, the diaphragm descends, which decreases the intrathoracic pressure and improves the interabdominal pressure. This compresses the blood in the inferior vena cava and forces it upward into the right atrium and helps to fill the heart. A well-pressurized system means that your throat, glottis, diaphragm, and pelvic floor are working together to pressurize your system. Many people have dysfunctional breathing patterns for a variety of reasons. Buteyko breathing is an excellent way to get the just right mix of air and avoid overbreathing. If you are not breathing well, you will not feel well. I will have an additional video with more information about the causes of dysfunctional breathing. Remember, all of these tips help to take stress off of your brain by avoiding microdoses of adrenaline throughout the day due to insufficient venous return. Stress, fear, and going beyond your physical limit mentally or emotionally also trigger adrenaline releases. Anytime you feel frustrated or irritated, it's a sign you're doing too much. This is likely the cause of worsening symptoms due to emotional distress or post-exertional malaise crashes. I have an excellent video regarding post-exertional malaise and pacing available if you have not viewed them already. This presentation was by Jenna Hopkins with TouchTree Integrated Living. And remember, this is just one way to help your body avoid adrenaline. You can reach me at touchtreelife.com, where I offer classes for free, touchtreelife@gmail.com, or I'm on social media at touchtreelife. Thank you.